love to do being outside and being with friends and doing whatever I could before sleeping and do as much as I could during the day. I like to swimming, riding my bike, camping, and I'm in 4-H, so I did a lot with that too. I had a really bad headache. It hurt so bad I couldn't even open my eyes. And after that we went to the ER, and I really don't remember after that. I couldn't talk or make sense or anything.
She would talk, but her sentences didn't make sense, and then she'd kind of start laughing and going, oh, that didn't really make sense, did it? And I was thinking, what in the world is she talking about? We decided to take her to the doctor. Scott met us in ER, and that's kind of where everything happened. From there we saw the neurologist in Norfolk, and he sent us here. As soon as her angiogram was done, Dr. Sordell came up and told us we needed to do surgery.
She came in with presenting with headaches and difficulty with speech, and she had clinical evidence of a stroke from the vessel clotting off.
The big words that they said, did they say aneurysm?
Aneurysm and stroke, yes. I honestly can't tell you what I thought. Probably just disbelief, what in the world was going on.
1% of aneurysms really affect children, and so it's uncommon in children to present with an aneurysm. In order to try to prevent her from having more stroke, we had to treat that aneurysm.
First thing I remember is seeing my Uncle Tim, and then after that I remember seeing all my friends and everybody that came into the hospital to see me.
Did they ever say, Katie, you had a stroke?
No.
No one ever told you that?
Not until my mom and dad were talking, and I kind of got some bits and pieces about it. I know what I was talking about, but I couldn't say, oh yeah, that's a pen. Oh yeah, that's this. I couldn't remember what everything was, but I knew what it was. I just couldn't say it. It was very hard.
She had a lot of difficulty communicating that very first day. It was very effortful for her to even get out one word. And she had trouble understanding. She was emotional, she would cry, and her mom and dad were very emotional too. So yeah, the first day was a tough day. I have a 16-year-old child, and I could really see myself, and I could really relate to what they must have been feeling to have those skills and that child that they knew change from 1 minute to the next and not be able to speak had to be heart-wrenching. And I saw that in them and recognized how I would feel. She was recovering very rapidly. You could see that joy coming back. You know, the very last day, not only was she so excited to go home, but she was excited to see everybody and show them what she could do. So it was really gratifying. It's great when we can get the end of the story, because sometimes we don't get to see the end of the story in the acute care facility. So it was really nice seeing how rapidly she progressed, and I can only imagine she's probably back to normal now.
I hate hospitals, I hate doctors and everything, but once I saw everybody, and they were very nice, and they did better than I would have thought. It was awesome. Everybody were so nice. They would help with whatever you needed, and they were very, very nice people.
We have an excellent team of residents and nurse practitioners and physician assistants who play an integral role in making sure that, you know, we can do the surgeries that we do and that the patients get the care that they get while we're in the operating room.
The nurses, oh gosh, they were fabulous. Every shift of nurses was just one nurse after the other. I can't tell you any of them was better because they were all awesome. The
nurses that we have both in the intensive care unit and the floor are some of the most compassionate people. They are intelligent, they're caring, and they provide not only the patient but the families with wonderful care.
We have told them, wow, what an awesome place. She received the best care she could have. And we put our faith in the doctors, the nurses, everybody that we saw, that they would take care of her to the best that they could.
It was a really good goal for me to go to prom, to get out of the hospital and to go to see everybody. And it was like the first time I could see everybody after my surgery. It was lots of fun just to do everything, and You couldn't see anything from my scar or anything, so it was really nice.
She's already made great strides, and I expect her to make more. She's made an excellent recovery.
Thank you for everything you've done for us, and I hope to see everybody again because they were very nice.